All right, so I'm Bitsy. This is going to be my postpartum assessment of a patient. We were given a scenario of anybody, I believe, basically 12 hours to 48 hours after giving birth. She is right at about 3 days, so we're going to say about 36 to 38 hours post delivery. First thing that I would do is go ahead and perform co-wipe. So I am going to check my order. My order is to do a head-to-toe assessment on my postpartum patient. I am going to assess allergies. Do you have any allergies? Patient says no. I'm going to go ahead and wash my hands, which I would do now. I'm going to provide privacy by pulling the curtain, closing the door. I'm going to identify that this is the correct patient, checking wristband using 2 identifiers, ask her name and date of birth. She tells me. I'm going to explain to the patient that I am basically just performing a routine postpartum assessment, which we do on every patient after birth, and answer any questions that the patient has. So first thing that I'm going to do is I'm going to go ahead and obtain vital signs. So I would get the blood pressure. I would go ahead and listen for her heart rate, listen for her breath sounds at the same time. So 1 minute of the epical heart rate, taking that. I'm assessing the breath sounds now, so listening over here, and here, here, and here. I'm going to ask my patient to sit up, and I would listen for the breath sounds here, 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 and here. Okay. So I've taken the pulse, I've listened for the lung sounds, and I've gotten blood pressure, heart rate, temp. I can go ahead and assess pain value. So I could ask my patient to rate her pain on a 0 to 10 scale. At this time, my patient doesn't really have a whole lot of pain, so she rates it about a 2 or a 3. Once I have done this, then I'm going to go ahead and inquire about her voiding and her stools. So have you urinated since you've delivered the baby, and when was the last time?
It was about 2 hours ago, and I peed and pooped.
Okay, and how would you describe your stool?
It was a normal brown color, and it was solid, and it was quite a bit.
Okay, so once I've established that on my patient, I can go ahead and make mental note of all the vital signs and of this stuff. So the next step in assessing the postpartum patient is to assess the nipple and breast area. So when I look at the breast, I'm looking to see if there's any engorgement, if there's any reddening, or if there's any drainage stuff coming from the nipples. So my patient is lactating. She is going to be breastfeeding her baby. So I am noticing the leaking of the breast milk, the lactation, and she is engorged. So I would inquire how long ago she fed the baby. She tells me that it was roughly about 2.5 hours ago. I would go ahead and educate my patient to make sure that she is breastfeeding every 2 to 2.5 hours. Try not to go any longer than that. There is no redness around the breast. There is no cracking of the nipples. The nipples are intact. I don't notice any bruising or anything abnormal. So at that point, I'm going to go ahead and move down into the uterine area and the fundus area of my patient. So being that she is about 36 hours postpartum, I should notice that the fundus is approximately 3 fingers below the umbilical area, and the fundus is firm in nature. It is not boggy, and it is midline on my patient. So once I have assessed the fundus, the uterus, the breast on my patient, while I'm doing this assessment, I could also be educating my patient that she could be wearing a nursing bra, something firm to give support to her breast. If she was not going to breastfeed, I would inform her not to use any warm water or warm soaks on her breast because that will encourage the lactating. She is able to stimulate some of the lactating to decrease the engorgement and the soreness of her breast, but needs to be small amounts spaced out periodically throughout the day. And ice packs are a good thing for her to use. So once I have assessed the uterus and that I already have assessed the bladder of my patient, I don't feel any, bulging of her bladder. She has already explained to me that she has voided. She does not have a Foley in place. We are recording her urine output, and it was measured at about 200 mLs. So it was normal in odor and yellow in color. It was a little cloudy. I would go ahead and inform my patient to continue to hydrate. She needs a little more water and fluids after giving birth to the patient or after giving birth to her baby. So in this process, this whole entire process, we're basically using BUBBLE-A as the acronym so that we know where we're going. So after I have done the bladder, my next would be the bowels. So in the bowels of the female, I would ask if she had had any stool, which she confirmed that she had about 2 hours ago, that it was firm. I would ask her if she's had any straining or if she suspects that she might have any hemorrhoids going on. Once I have assessed the bowels of my patient, I would go ahead and ask about the lochia, which is the amount of bleeding that she's having postpartum. Being that she is about 36 days out, she should be having the serosa. So we should have already stopped the rubia process and we're into the serosa blood. So if I asked my patient, how many pads are you soaking in a day? She's roughly going to tell me about 4 pads a day. And if I asked about the color of the blood,
It's a rusty color, like a reddish brown.
okay. And I could also inquire a little further, asking her in the amount of blood, whether it's scant, large amounts. At this point, it should be moderate bleeding, nothing big, nothing heavy. My patient confirms that with me. So, have you had any clots in your blood?
No.
No clots. All right, so after these, I've now assessed the lochia. The next is going to be basically providing emotional support for my patient. So I need to make sure that I am also, while I'm in this area, explaining to my patient, that she may suffer some depression, some blues, some, crying spells, feeling scared, feeling like she's not able to take care of the baby. I would provide emotional support, explaining to her that those are kind of normal thoughts and feelings. While I'm doing this, I'm going to ask her to start to roll onto her side. And at this point, I'm checking for her episiotomy, which my patient, to be able to see it, when I have her lay onto her side, I would ask her to take her leg on the top part up and extend. So I am now inspecting the bottom of the patient, looking for any hemorrhoids, looking for any redness or signs of infection around the episiotomy site. I don't notice any drainage. I don't notice any clotting. It does look like it's healing pretty well. There's not really a whole lot of erythema around it. So I would go ahead at that point and let my patient roll back over onto her side. And so at this point, once I have assessed all of those things, when I'm giving my patient the emotional support, I'm answering any questions my patient has. The process of giving birth now, typically within a day or two, the parents are released home to take care of their babies. So there are hotlines that they can call. There are family members. Encourage my patient to reach out, ask questions, ask loved ones for help. You need to encourage the patient to sleep and rest as much as possible. Of course, having a newborn, you're going to be up and down all the time. And breastfeeding, make sure to educate the mother on not having the child in bed with her, on, the routine feedings, the routine changing. I've already talked to her about the blues and the crying and all of that good stuff. And sorry, my daughter's recording the video and she's moving around a lot, so I'm probably getting shook up a little bit. that will stop. And once I have done this, I'm also going to talk to her about her energy level. She needs to make sure that she, when she's resting and then when she's up, she's doing ambulating and walking and getting around and kind of, getting her body back into the swing of things. And her energy level will start to increase. She needs to be eating a nutrient diet rich in, continued fiber for the episiotomy and keeping her bowels moving. She still needs to be keeping her calcium up, it does help sometimes to continue taking your prenatal vitamins for a little while, especially since she is breastfeeding. And once I have educated my patient on all of that stuff, I can do a quick assessment while I'm standing here. I'm looking at her skin. Her skin's intact. It's normal capillary refill. I'm also checking for edema and swelling in the lower extremities while I'm standing here. And I do notice that she does have some swelling in her lower parts of her legs. I would go ahead and check for pedal pulses. And I would check for any kind of pitting edema. She's roughly at about a 1. Another thing that I would check for while I'm here is the Homan's sign. So in doing this, I'm looking at the calf of the patient. I would ask her to dorsal flex her leg, and if there's any pain in the back of her calf. At this time, there's not. I don't note any reddening on the back of the calf. Same thing over here. She dorsal flexes. There's no pain, no redness on the back of the calf. Those are all good signs. If there was any of that, I would notify my RN or my physician, and they would run some tests to make sure there is no thrombocytes in the back of her legs and no embolisms that she could be having. And after all of that, I'm going to ask my patient if there's any questions. I would make sure she has her call light, make sure my bed is in lowest position, and I'm going to go ahead and document all of my findings. And that completes my video.